Well, thank you for this opportunity to present this. This is a randomized, double-blind, phase 3 study of pembrolizumab or placebo in combination with pemetrexed and platinum as first-line therapy for metastatic non-small cell lung cancer. These are my disclosures relevant to the work. Pembrolizumab is a humanized IgG4 monoclonal antibody against PD-1, which is approved already as monotherapy for previously treated non-small cell lung cancer for those with PD-L1 expression greater than or equal to 1%, and in the first-line setting for those with PD-L1 expression greater than or equal to 50%. A prior randomized open-label phase 2 study looking at the combination of chemotherapy with pembrolizumab demonstrated an improved response rate and progression-free survival and was the basis for this larger-scale global study conducted in 16 countries, 126 sites. In this study, untreated stage 4 non-squamous non-small cell lung cancer patients without EGFR or ALK alterations and those who had a good performance status and could provide archival tissue for PD-L1 were enrolled. Patients without symptomatic brain metastases were allowed, so asymptomatic brain metastases were allowed, and patients were stratified on these factors you see at the bottom. Patients were randomized 2-to-1 to receive pembrolizumab or placebo in combination with platinum and pemetrexed standard chemotherapy. After completion of standard therapy with 4 cycles, patients went on to either pembrolizumab, pemetrexed maintenance therapy, or placebo plus pemetrexed maintenance. For those in the control arm, they were allowed to cross over to pembrolizumab monotherapy if blinded independent central review confirmed progression and they were eligible to receive pembrolizumab. These are the baseline characteristics of the patients, which are overall similar, with the exception of there was a slightly higher preponderance of men in the combination group, slightly higher percentage of those who had PS1 or who had had prior thoracic radiation in the control group. Overall, there was 17 to 18% of the patients who had brain metastases, and about a third of those were untreated. This is the overall survival Kaplan-Meier curves showing that there's a clear difference between pembrolizumab in combination with pemetrexed platinum compared to chemotherapy alone. The hazard ratio for death was 0.49 with a p-value less than 0.00001. And the median overall survival, while 11.3 months in the control arm, has not yet been reached in the combination arm. But a landmark analysis at 12 months suggests that 69.2% of patients should be alive compared to in the combination arm compared to 49.4% in the control arm. These are the breakdown Kaplan-Meier curves by different levels of PD-L1 expression, and I think what's notable here is that there was a clear benefit across all subgroups. Although there is the highest benefit with a hazard ratio of 0.42 in those with greater than or equal to 50% expression, the hazard ratio is still 0.59 for those with less than 1% PD-L1 expression. These are the progression-free survival Kaplan-Meier curves demonstrating, again, a benefit of the combination over chemotherapy alone, with a median progression-free survival of 8.8 months versus 4.9 months, and a landmark analysis suggesting that 34% would be estimated to be progression-free and alive at 1 year in the combination, compared with 17.3% in the control arm. The overall hazard ratio for progression or death was 0.52, again, highly significant. And these are the Kaplan-Meier curves broken down by PD-L1 expression. Again, you can see that there is an increasing benefit with increasing levels of PD-L1, but there is benefit overall with a hazard ratio of 0.75, even in those with less than 1% expression. And response rate, again, was also beneficial overall with the combination compared to chemotherapy alone. The overall response rate, 47.6%, compared to 18.9%. And I think what's notable, again, here is that the highest levels of PD-L1 expression, those patients did the best with a 61.4% overall response rate. The adverse events overall were similar between both groups. Grade 3 to 5, 67.2% in the combination, 65.8% with the control, similar numbers leading to death. There was a higher level of AEs that led to discontinuation of all treatment, 13.8% versus 7.9%. But as you can see, the immune-mediated side effects, which are predominantly in the immunotherapy arm, overall were not significantly more than they are with monotherapy, with similar numbers of grade 3 to 5 events and those leading to death, as has been seen with monotherapy with pembrolizumab. These are the AEs overall, greater than 20% from any cause, which you can see look fairly similar between both groups. There's a slightly higher preponderance of nausea, diarrhea, rash, and grade 3 to 5 neutropenia. When adjusted for dose exposure, those differences go away with the exception of febrile neutropenia. These are the immune-mediated adverse events, which again are comparable to what we see with monotherapy with pembrolizumab. Pneumonitis, although there was a higher rate of grade 3 to 5 events compared to the control arm, was still overall less than 5% in this study. Nephritis might be the only outlier with a rate of 1.7% compared to 0.4% for monotherapy historically. And renal events overall were more predominant in the combination arm. Each of the drugs in the combination arm, pembrolizumab, pemetrexed, and platinum, are associated independently with renal toxicity, which may play a role, but the overall frequency was 5.2% in the combination arm versus 0.5%, the grade 3 to 5, 2% versus 0%, and 2 led to death. Most of these events were occurring, however, in the setting of acute illness, multiple other concurrent toxicities, and were likely multifactorial. Nephritis had some overlap with the overall acute kidney injury with a total frequency of 1.7%. It's difficult to know how much of the overall renal toxicity was inflammatory or immune-mediated because most patients did not undergo renal biopsies. And in the interest of time, I will skip the summary and just sort of say in conclusion, adding pembrolizumab to pemetrexed and platinum induction therapy and pemetrexed maintenance therapy significantly improves overall survival, progression-free survival, and overall response rate in patients with previously untreated metastatic non-squamous non-small cell lung cancer without EGFR ALK alterations. Overall, pemetrexed plus pembrolizumab and platinum has a manageable safety profile and really may represent a new standard of care for first-line treatment of this group, irrespective of PD-L1 expression. Thank you.